Good afternoon, everyone. Today, I would like to share a topic which is knee osteoarthritis. Um, so, first of all, I will give an example. 75 years old person who has had a um, bilateral um, mm, bilateral knee soreness for many years. And at first, it was only mild discomfort after walking, and which improved when he having enough rest. And over the time, he noticed that in the morning, there's lots of stiffness in his knee, and um, requiring some time before he could get out of the bed and walk normally. And in the past 6 months, his knee have become swollen, and the pain has worsened to the point where he can't go up and down stairs properly. Rest no longer relieves the pain. Um, After the medical evaluation, he was diagnosed with knee osteoarthritis. So, what is knee arthritis? Knee arthritis is actually a degenerative joint disease and is one of the most common musculoskeletal conditions. According to the statistics, the among people over 65 years old, there's 50% of the possibility that people suffer from osteoarthritis, and which means one in every two elderly individuals suffers from the knee pain that caused by arthritis. The main causes including aging, obesity, previous injury, and poor posture, all of which lead to cartilage degeneration, damage, and breakdown in the knee joint. Um, so now let's look at how many types of the arthritis, knee arthritis, osteoarthritis, or like how what's the stages of the disease. So first one, the stage one. So usually it's there will be early for bone spur formation, not really obvious knee pain. And stage two, there will be more. So maybe I can show you photos for stages. So you can have a look on this picture here. And as you can see, there are four stages of the knee osteoarthritis. The first stage one, usually that's the early bone spur formation, and you can see that actually there's no obvious pain, so you can still walk. You can still do exercise. And stage two, there are actually more bones were formed and could be mild cartilage wear and slightly narrow the joint space. And the pain will be mild and stiffness as well. So sometimes like it's not severe serious symptoms yet. So it doesn't really affect you to do stuff that much. But you already start to aware of it. And then it comes to the third stage. Oh yeah, so it's a little bit different here. So it's like this photo is divided into five stages. So the next one, the middle one, it's called mild or minimal. And so actually, yeah, so either you can divide into four stages or five stages. And so anyway, the next stage, there will be multiple bone spurs and there are some significant cartilage wear. And even the joint space is narrowing. Um, and um, so I just need to leave for a little while. Just let me have a look. So you want to as late as possible. Okay. Yeah. So tomorrow we can do. Yeah. So the latest one will be maybe like for example 4 o'clock or 4:30. That's the latest. 4 o'clock. Okay. Yeah. So I just need to find your name. Can you spell it again for me? Sorry, I couldn't. Can you say it again? Okay. Phone number. Okay. Maybe I can try. Oh, I think this one I can't search by phone number. Um, yeah. Um, I couldn't. Maybe I just go back to the appointment so I can see it easier. So your last time you came was 2 or 3 weeks ago. Oh yeah, yeah, I found it. Yeah, I found it. Yeah. Okay, so I booked for you four four 4 o'clock, right? 4 or 4:30. 4 o'clock. Yeah. Okay. So maybe 4 o'clock. Yeah. Okay. So yeah, I booked for with on my I'll treat you tomorrow, but Chanel will be here if anything. We can ask him as well. Okay. See you tomorrow. Bye. how to get rid of the body pain and headache. Are you still here? Sorry, I just read your message there. Sorry, I was busy before. Yeah, so actually we are here to share the Chinese medicine acupuncture treatment, and it's because in clinic we have lots of successful cases that help to get rid of the body pain. Of course, if you couldn't get acupuncture treatment, you can also study the knowledge, and then you can use the acupressure point to massage on the spot. It also help. So I will continue to finish the main stages of the osteoarthritis. So and the third stage, the joint space is getting narrow, and so the pain during the movement and the joint and the possible joint making the sound. So like on the second and third stage, you will definitely feel more discomfort, and you have more frequent pain with movement, and then you feel more stiff in the morning. Even if you sit for a long time, there will be visible swelling of the joint possible. So, and then on the last stage, so on the stage 4, so extensive bone spurs will be generated, and actually there will be also severe cartilage loss, and bone on bone contact will be almost no joint space. So there will be like extensive bone spurs, as you can see on the last photo. The high pain on joint usage daily activity is very difficult. It's intense stiffness, and it's severe swelling and inflammation. Um, so actually on the last stage, it's really, really painful. Um, if I can find more photos so I can show you. Stage 4. So I want to show you this photo. So as you can see, this one, that's the normal knee. That's normal knee joint space, and the osteoarthritis is will be look like this. It's actually lost the joint space. So that is a severe arthritis. Um, as That's extensive bone spurs occurred, and that the cartilage already lost. So and okay, so she show you another one. As you can see here, As you can see here, that's more easy to observe, to see. Um, so the cartilage has been reduced, and reduced, and there's no space between the joint, the bones, bone to bones. So that's the 4 stages of the knee osteoarthritis, and so now comes to share the treatment. So the treatment will be also depend on the different stages. For example, if it's on the first and second stage, the lifestyle and exercise is very important. And also for those who have overweight, you should try to lose some weight, and you can do some swimming. And then you can strengthen your muscles like your leg and your thigh, and that will help you improve your knee joint mobility. And the acupressure point is definitely help to promote the blood circulation and reduce the chronic inflammation. And the acupressure or oral pain medication or herbal medication will also help for the symptoms relief. So that is the more the first stage. Share this one. And then the second, the third stage. So how do we treat the third stage of the knee osteoarthritis? So so the first one will be also very important, which is our lifestyle and exercise modifications, and then to strengthen the muscle and the joint mobility, to do some exercise, some trainings, and also plus acupressure point. It's really important, and you can, if it's necessary, you might want to take some medications if the pain is get bad, and or you can try some herbal medication. Herb medication actually, it's very natural, and a lot of herbs can help to reduce the pain and promote promote blood flow and reduce the blood stasis. So at some point, it's a lot of people, especially in China, in the hospital, a lot of doctor prescribe herbal medication for osteoarthritis patient as well. And or if like, because when it's getting worse, like on the stage 3 or stage 4, so the doctor usually will suggest you to do the intra-articular injections. So that's one of the very common Western medicine treatment method. So because that can help provide a rapid relief of the inflammation and joint pain. So like, especially everyone have different pain tolerance. If it's like really hurt, and it's already affecting your normal life, so you don't want to live with the pain all the time. So maybe that can be one of the options. But there's lots of people, they are trying not to do the injection because they worry about the side effects, while highly effective at the targeting local pain. Of course, like for example, um, after the after the injection, you might be experience a short term and increasing in the pain. And some people found it works really good. Some people not. Um, and so um, so because on the stage 4, it's already the worst stage. So the doctor or the specialist would might be suggest you to do a total knee replacement surgery. That is also what like one of the treatment method when it's um, reached to the severe conditions. And so for acupuncture, what you can do at home. So there are actually a couple of the points might be benefit for your knee. So the first one is spleen 10. Spleen 10 is just the inner side of your knee joint, but um, it's like about 3 finger less, like upper on the inner side of the knee. So this is spleen meridian. So the spleen 10 is on the spleen meridian, like about 3 fingers from upper up above your knee. So massage this point. It's actually help to promote the blood circulation. And there's also another one. It's actually also 3 finger above the knee, but it's outer side of the knee. So the first one is inner side. The other one is outer side. It's both on the same level. That is the stomach meridian. That's stomach 34. So these 2 points. Before you go to bed, you can gently press both sides of the following acupressure points, about 30 pressures per minute. You can massage for like a couple minutes, and even you can massage it at daytime. So yeah, so that is about today's topic, which is knee osteoarthritis. So I hope that it helped you to have a better understanding of the knee osteoarthritis different stages and the different treatment methods. Thank you for your watching.